Hello, Scott Holdsworth with the Recon Sales Academy here with you today. I'm joined by Mr. Ty Hollister, Global Product Manager from the HIP Marketing franchise. Today we're going to showcase our newest entrant into the HIP revision portfolio. We're going to talk about the new Redapt Revision Femoral System. First, we'll take a look at the instrumentation, a review of the implants, and then we'll take you through a sawbones demonstration. So let's get started.
Hello. Today we're talking about the Redapt Revision Femoral System, a system that offers your surgeon rock-type fixation, adaptability, and reproducibility for them to tackle their revision cases. Before we get into the sawbone demonstration, I wanted to make you aware of some of the tools that are available to you today on Sales Life and Print on Demand. We have the Redapt Surgical Technique, the Redapt Messaging Brochure, Instrument Guide, and a compilation of training materials that we've done and put together from our sales training efforts this year. We also have the Redapt templates. Today we'll be doing a sawbone demonstration with the proximally fluted 240 millimeter implant as well as a modular sleeve 300 millimeter implant. For the purpose of this demonstration, we'll be using a size 15 implant, and you can see what a template looks like for the size 15 proximally fluted. Now we will review the Redapt Revision System tray layout. The Redapt system goes from size 12 to 27 in both 240 and 300 millimeter lengths. What we define here as the core set, which is representative of these 5 trays, supports a 240 stem from size 12 to 21. The trays that are in the core set are the common instrument tray, the 240 distal reamer tray, the trial head tray, proximal reamer tray, and extraction tray. For cases where you template close to a 300 or think you might need that, there's an additional 300 millimeter reamer tray that should be brought in for these cases. This also supports the core from 12 to 21 for the 300 millimeter stems. For cases where you template to a size larger than a 21, we have the large size reamer sets to support a size 22 through 27 in both the 240 millimeter length and the 300 millimeter length. For detailed tray layouts, you may refer to your instrument reference guide available on Print on Demand and Sales Life Online. Now we will look at the implant options available with the Redapt system. The Redapt stems come in lengths 240 and 300 millimeters in size 12 through 27. The first type of stem that we will look at is the PF, or proximally fluted stem. This stem is designed for use when proximal defects are minimal. The next stem that we'll look at is the modular sleeve stems. These stems allow for the use of a modular sleeve when there's proximal distal mismatch. There are 3 sleeves available with stick-tight coating, a small, medium, and large, as well as 1 extra small sleeve available with grit blast surface. All Redapt stems use modular necks, and we offer 5 different modular neck varieties in cobalt chrome: a standard, high offset, right and left anteverted, and a high offset plus 10 neck.
Okay, let's get set up for our sawbones demonstration. As you can see here, we have our core set of instrumentation out here, including our 300 millimeter reamers. Our initial preparation will be a 15 millimeter by 240 millimeter proximally fluted stem. Okay, let's actually do a sawbones here on our bone. So again, our preparation is going to be for a 15 millimeter distal diameter via 240 millimeter length stem. And the important thing about the Redapt stem is that that measurement is what we call tip to tip. So the top of the shoulder here to the distal tip represents that 240 millimeters. So in essence, this is a greater trochanter referencing system, and our stem is going to sit in roughly that orientation within this shot. Okay? You'll notice that in the Redapt stem, you can see this is a 3-degree tapered stem. It also has a chamfer here on the distal aspect. You'll see how important that is as we do a 300 millimeter stem, in that it easily clears the anterior bow of the femur. Okay, so again, we're going to do a 15 millimeter by 240 millimeter preparation. First step in the process in the PF technique is your starter reamer, okay, on power. Some may call this a bit of a lateralizing reamer. And the important thing to note here is that this etched line on the reamer, everything references the top of the greater trochanter. So this reamer will go down no further than the top of the greater trochanter at this point. So that's about all that we want to ream this. Now, with the PF stem, second step in the technique is to utilize the rasp. And the important thing to remember here is that this mimics the top of your implant. So if you will, the shape of this, so the height that you seat this rasp is equivalent to the shape of the implant. And it's also important to note that this sets the version of your stem as well. So as you compact this down, this is going to be equal, again, with the top of the greater trochanter. And you're going to want to set your stem version, importantly. So we take this down to that point. Now we've set both our version and our height of the implant. And as you can see from our preparation, that there was a decent amount of bone taken away, but this is where our stem is going to sit. And rasp comes out. Now, next step in the process is our distal reaming. I've set out distal reamers here in order. We're going to start with a 13, followed by the 14, and then the 15. This canal has already been prepared to a size 11 synergy preparation, for instance, so we are revising that to a size 15 Redapt stem. These are quick connects. There are 2 of them in the set. As you can see, you slide. If you look at the diameter here is a bit of a square. So your distal reamer fits into that, pull up, and it locks in place. And it is a quick connect. This is then attached to power. And again, from an orientation standpoint, our depth is to this black line. This black line, again, becomes the top of the greater trochanter from a referencing standpoint. So this is our size 13. And stop. And bring this back out. And we go to our size 14. Same thing. Same place and stop. Bring that back out. Make sure we're locked. 15 millimeter goes on. Now the important thing here is that this is our definitive size distally once we get to chatter. Okay? See how that's laboring? Take it down. Now we take this off and we remove our T-handle as well. All right, so now we have our distal reamer in place, and we're going to now proximal ream. Our proximal reaming in a PF stem, if you can see this, is for a 14-15 stem is reamer number 1 that I think you can see right there. So number 1 reamer is what will define your proximal geometry for the PF stem. Again, this goes on power. And again, we're going to only ream to the top of the trochanter again. This goes over top of the distal reamer. So there we go. That's as far as we ream for our proximal body. Bring that back out. If you're not happy, you can make sure that, okay? Now we've established both our distal and our proximal geometry. Now we're in a position where we can trial for the trial assembly. So you have a proximal spacer that you can see here that tapers. You can see these teeth here. Those teeth go onto the top and go down on top of your trial. You have, in the PF version, you have two different trial bodies that you see here. One says 12 to 15, if you can see that in my left hand. The other says 16 plus. All right. Since we're putting in a size 15, we'll be utilizing the 12 to 15 body. Important thing to note here is that these teeth line up with the teeth on the top of the proximal spacer, your screwdriver that you have in the set. If this screw head right here does not pop up, then you are not seated appropriately on the bone. So then this gets tightened so that that is tight. All right, now we have our trial in place. We have various plastic versions of your trial necks. In this case, we have standard offset and high offset. In this case, I believe this patient is probably a high offset. Place that in there. We'll go with a size 36 millimeter +0 head. Check our length. And right now, perpendicular, we are intersecting exactly in the center of the femoral head. So in this case, we have an anatomic reconstruction with a 15 by 240 Redapt stem with a high offset neck and a 36 +0 head. So that is your trial component. So now to take those components out, your plastic components come out. If you're lucky enough to have the entire thing come apart, then that's a blessing. But in many cases, what you may have to do, if that connection is very difficult to get out, you have a hook, if you're familiar with the Empyrean system. If it's difficult to get to that, one of the things that you can do is use the hook that's in here on the long handle that threads together. And then if that's seated, all right, and we're having a hard time getting it out, okay, we can simply slap that out to remove that and pull your assembly out. Now, similar to the Empyrean system, it's probably best not to disassemble this and leave this on the back table in case they want to continually take a look at that. The nice thing here is, again, as we overlay our implant and our trial, you see that our geometry matches perfectly. So then to implant the stem, your stem inserter is here. Pull the handle out. This is a threaded attachment that then threads on. Okay. Threads and then tightens. Okay. You do have version handle here if you wish to utilize, which would then thread on in this particular manner. If you wanted to assess your version for this demonstration, I'm going to go ahead and take it off. Then your stem is introduced into the canal. You should start to see bite at about this junction. All right. Then it's simply making sure your orientation is correct and gently tapping the stem down to its position. Removing your stem inserter. Then if you wish to trial again, you could do that. Your high offset again. Okay, so now that we have our stem in place, now we want to implant our cobalt chrome modular neck. In this case, we had said that we were going to use a high offset. So you can see here with the arrow on top, for those of you that have successfully sold the SMF stem, all right, you know that the arrows go up for your high offset. So the neck goes in, your 36 millimeter oxinium head then goes on to your taper. You have a head pusher, head impactor in the set, and then impact. Then close the hip and reduce and close. So here you have a reproduction in a sawbones model of a 15 by 240 millimeter proximally fluted PF stem utilizing a 36 millimeter oxinium head with a high offset neck. Now let's transition to our modular sleeve version, or the MS as you may have heard of it. So what is our construct here? So now we are changing to both our sleeved version, but in addition we're going to go to a 300 millimeter version, and again our length is measured tip to tip, so proximal shoulder to distal tip, that represents a 300 millimeter length with this option. And again, that distal chamfer really helps you get through the anterior bow of the femur so that you don't need a bowed stem, and one straight monoblock stem construct that is not a bibody is able to get through the bow and give you the length that you need. All right? And in this particular case, what we're going to construct today is the modular sleeved 15 millimeters by 300 length with a small sleeve that you see here. And that will go in as one construct. And again, as we look at the top of the femur, it's going to be about in that orientation on the femur. So let's go ahead and get started. First step, as we saw with the PF version, the first thing that we really want to do is we want to set that distal diameter so that we know that for this cooperative patient, we've set that as a 15 millimeter distal diameter. So this patient has already previously been a 15 by 240, so now we need to convert that to a 300 millimeter length using our extended length 300 millimeter reamers now. So again, our orientation is, again, this solid black line coming down even with the greater troch. So you can see that we are much further down in the femur with this 300 millimeter length. Okay, so let's start our distal reaming. I'm going to start with a 13 millimeter by 300 distal reamer in our preparation. So down the femur. And again, we want to ream only until we get to the top of the greater trochanter. It's important that whatever landmark you decide on, be consistent. That's all part of the reproducibility aspect of the system. So we're down to the top, take it back out. Now we go to a size 14 that I have preloaded. Same thing. There's our 14 to the same spot. Bring it back out. Load up the 15 to the quick connect. Make sure it's locked in place. And now we do our 15 reamer. As you can see, the inside of this sawbones has a pink colored construct to show you the inside of the femur. You can see from our reamer that up here at the top we've got a lot of pink bone, but distally we've got a lot of white bone, which says we are very close to our correct size here. So there we go. Ream to depth, take it off of power, remove the quick connect, and now we're ready to proximal ream. Now, once we've done our distal reaming, we move to proximal reaming. I want to make sure that we have, either in electronic form or printed form, your Redapt surgical technique within the operating room, just to kind of keep you out of trouble. As you can see on the screen, you'll have a proximal reamer color code chart telling you what size proximal reamer that you need for the various sizes of stems. In this particular instance, for a size 15 300, we're going to need 4 different proximal reamers that you'll finish up with. We've already reamed this proximally with the size 1 reamer. All right, we'll go ahead and load that so that you can see it in case we need to remove anything else. And again, that goes over top of your distal reamer. So again, setting our depth. So we move from the number 1 to the number 2 reamer that you can see here. And with a size 14-15, we need to get to a size 4 proximal reamer. So we need to make sure that we are on top of, and now we've reamed there to our line. Take that back out. Change from the 2 to the 3 proximal reamer. Same depth, bring it back out. And then our last reamer, and I'll show you on the close-up so that you can reference on the screen here so that you can see there. This is for a size 14-15, and the S here stands for small, which is the size of sleeve that we're doing. So we know that a size 4 is our definitive reamer for this size from a proximal reaming standpoint. And that will bottom out. So bring that back out. So now we've finished our proximal reaming. Now we'll go to our osteotomy guide, just in case we've got some bone that is in the way. So now that we've done our distal reaming and our proximal reaming, one of the things with the modular sleeve version of the stem is that you can see that there is an engineered gap here between the sleeve and the implant itself, very similar to what you have seen and experienced on the Empyrean system. That is there so that you have the ability to disengage the stem from the sleeve in order for explantation, or if you need to get this thing out. All right, so what we have now is we have an osteotomy guide here to allow you to prepare for that. We want to make sure we've got a nice level cut across the proximal femur so that we have clearance for that. So in that case, you're going to need your trial spacer body, which goes over top and all the way down. All right. Then again, this osteotomy guide has 3 different adjustments here, all that take the same screwdriver. So this slides over top of the trial body, the threads engage, then this tightens down, okay, like so. And again, we're following the version of the femur here. Then we need to rigidly tighten this so that we get no rotation here. And now this is just simply an adjustment in this plane. So bring it down. You can simply then tighten that down. So now we've got a nice rigid construct. And what we're going to be doing is our saw is going to come through. We've basically got a guided motion cut here, or a captured cut, if you will, similar to what you would see on a femoral block. So now that we've made that cut, now we can remove the osteotomy guide here and here. And take that off. Now, you can clean up the cut. Same thing over here. A fan blade would probably make that a little bit easier, but then you can, in the operating room, rongeur or something of that nature to clean that up. So now that we have our osteotomy cut done, we have our trial spacer in there, it's time to trial. So again, your trial proximal bodies for the modular stem version are just a little bit different, but again, in my left hand you see the size 12 through 15. In my right you see the 16 plus. For our size 15 implant, we're going to use this one. Same situation, making sure that you line up your cutout grooves. You see that the screw has popped up, so that means you are in position. Cruciform screwdriver, tighten that down. Following your version, now we can actually trial. For repetition's sake, I do have, again, a high offset neck here and a plus 0 36 millimeter head that we can then check our position, top of the greater trochanter over, and you can see that we are in ideal anatomic position for our reconstruction. So that's our trial. Now it's time to put our real implant in. Remove the trials. Now, in this case, you can take your entire construct out with the hook. All right. That is one method of taking that out. Now, at this point in time, femoral preparation, potentially some lavage, cleaning it up, getting it ready for implantation, handing off into the field. What we recommend with the sleeved version is that it does go in as a construct, okay? So now we have gone from, this is our trial, all right, and this is our stem that we're going to implant. And as you can see, exact reproduction. Our stem then would be loaded onto the introducer. Locked down. Then our stem, and again we could apply our version handle if we needed to. Our stem goes in, making sure that we follow the version of the femur going down. Now that we're down, we remove the stem inserter. We go back to our definitive implant. Again, if you wish to retrial, you can. But if not, if you're satisfied with your location, your modular neck, high offset, 36 millimeter oxinium head, and again, coming across, we have a nice reconstruction there in a high offset, so you have nice tension and stability in the hip. As you can see here, we have a very nice looking reproduction of a 15 millimeter by 300 millimeter modular sleeved stem with a small sleeve. A couple of things I would like to point out to you that are in the instrument set. You have a couple of instruments in here, one of which is if you would need to get your taper out, okay, this is the instrument that would remove your taper, okay? So that instrument is in the set. In addition, if you needed to be able to separate the sleeve from the stem, then that is what your chisel instrument is, similar to what you see in the Empyrean set, all right? Then once you made that, once you removed your stem, but your sleeve was still down in there, one of the things then that you can utilize, and again, that's also within the Empyrean set, is your reverse curette that you can then insert, get a grip on the bottom of the sleeve, and slap hammer that out. So two or three nice instruments to aid you in positioning. One other nice instrument that's in here, and certainly helpful within a revision situation, is you have a stem removal tool here that allows you to thread this onto your stem. Once it's well fixed, these are a bear to get out. This end then threads into here. You've got a universal joint here. Threads into here. And then this fits into your renovation set stem removal tool. as a secure attachment that allows you to slap hammer this out with a very rigid attachment for this stem. So certainly something that can really get you out of jail quickly and efficiently in stem removal. One other thing that I wanted to highlight within that set is, as we go back to our reamers, if you were having difficulty, and again, with, for instance, like our 300 reamer, and we had trouble getting that out, okay, you have a sleeve here that you notice that this is threaded on this aspect. This fits down over top and threads into place, all right? So you've got a secure attachment here. Then, again, your fork attachment to go through to slap hammer your distal reamer if you get it stuck within the canal. Just a couple of neat little instruments that can certainly make your life a little bit easier as you're doing a Redapt stem. So again, what we've done today is we've done a 15 by 240 proximally fluted option with a 36 millimeter plus zero head on a high offset neck. Then we've made that conversion to our modular sleeve version, which is a 15 millimeter by 300 millimeter distal length with that same high offset neck and 36 millimeter oxinium head construct that, again, showcases adaptability of the stem. You saw through preparation, reproducibility of the stem, where the stem sits at the exact same height as the trial that you prepared. And then that Rock-Tite fixation, the Rock-Tite flute design, certainly enables you to have very good axial stability in terms of stem, reducing the chance for stem subsidence, and then great anti-rotational forces in that design, making it a very, very secure fit for your surgeon, that he can go into the operating room and prepare this device with minimal instrumentation, all right, and predictability in what he's going to see from his trial preparation, his reaming, his trial, all the way through to his implant preparation. Everything will seat in the exact same place. So that's all we have today for the Redapt femoral revision system. Good luck and good selling.